It's not often that your research like impacts your family. And so I still remember the day one of my children has ADHD, and they're on medication that's actually been really successful, and they've been on a stable dose of medicine for some time. And then I came downstairs one day, and they were literally spitting up their pill. And I was trying to figure out what was going on. They wouldn't take the medicines. They felt nauseous. Something had really changed. And I looked at the bottle. And we had a new generic version of the medicine. And I was a manufacturer I'd never heard of. And so I was kind of curious because I had been doing a lot of work on generic drugs and the economics of generic drugs. So I wanted to know where this drug was made. So I called actually the Stanford pharmacy and they couldn't tell me, based on the manufacturer and the label, where that was made or who, and so that got me really concerned that what we were seeing was poor quality medicine, and that's why they wouldn't take their pill. So actually I literally walked around town to go to different pharmacies to find out who their manufacturers were to see if I can get them back on their medicines. I ended up writing this up as an article for a medical journal and called our pediatrician and let them know this article was coming out. I didn't want them to be surprised when their patient was featured. And they said, thank goodness someone's talking about this issue. They had a whole panel of patients with ADHD, and every single month when their prescriptions were refilled, they had the same set of issues I was facing at home. We've been working on the economics of generic medicines as a topic for a while, but I hadn't thought a lot about quality, like how the economics of these products relate to quality and poor quality. And so when this happened to me at home, it really put the two together. The work we have been doing on the basic economics of this market and how firms responded to those incentives by bringing low quality medicines into the US market. It really kind of came full circle. One of the challenges is, here at Stanford, we should be working on really important questions. And I do health economics and health policy. Almost nobody was looking at the economics of the generic drug market. And so our work has really helped everyone to understand what are the essential features of this market, where this market is failing the American consumers. One of the amazing things here at Stanford is that you could take an audacious problem like this that impacts almost every American and think you can come up with an answer and think you can implement it. That's the power of our work. And, I've been at several academic medical centers. It was much harder to see a pathway to the solution from there than from here.